Coming up, 1/3 of Ipswich householders are suffering high or very high psychological stress. Distress levels are higher than the national average. You'll hear details from a new survey from Community Mental Health Australia, which highlights issues that need addressing. It's Friday, April 29, 2022, and I'm Alan Roebuck. Welcome to Ipswich Today, which acknowledges the traditional custodians of the land on which it is produced and pays respects to elders past, present and emerging. This podcast is supported by Kinetics, people-powered web hosting trusted by Australian businesses since 1999. Last October, I spoke with Tristan Brownson, who headed up the Assisting Communities Through Direct Connection project, or the ACDC project. Nearly 500 households in North and West Ipswich were door-knocked between September and December last year. Roughly half completed a survey detailing their experiences about mental health and accessing support. Local project manager Tristan Brownson joins me now to talk about the survey results. Thanks for speaking again with Ipswich Today, Tristan.
Thanks for having me back on the show, Alan.
What are the key numbers from this survey?
So there were around about 500 householders that actually completed the survey. And what we found, so for example, 43% of householders indicated they'd wanted to seek help for their mental health in the past 12 months. That doesn't mean that they did seek help. 40% of those said that they did not get the help that they needed.
And how does this compare to the national average?
Those percentages of people not getting the help they needed, look, we don't have all of the figures out of all the other regions yet, but, quite similar. There's almost half of people don't get the support that they need.
Were you able to drill down to specific issues? What were people saying about what caused their stress and mental health issues?
Local community challenges. So there were two parts to the survey. One was, what do you feel are the issues in your community? And then what do you feel are the issues for you individually? For the community challenges, 63% of people flagged that alcohol and other drugs were a big problem within their community. Individually, the highest at 43% was the COVID-19 pandemic.
That is very interesting. Number two on that individual challenge is climate change. That's what people in Ipswich and West Ipswich are saying. That's certainly one for federal election candidates to take note of.
Absolutely it is. And interestingly, this project was done before the recent floods. So I would potentially think that if we were to redo the same project at Ipswich right now, even South East Queensland, Northern New South Wales, that would probably be higher.
What kind of help and support do people need?
One of the things that the majority of people were interested in would be a peer support model. So working with people, so peer support workers have lived experience of mental health, drugs and alcohol, whatever it may be. So majority of people that said they would engage with supports were actually really keen to engage with peer supports.
Tristan, can you just explain a bit further what that peer support would entail? So
peer support, as I said, is people with lived experience of drugs and alcohol, mental health, whatever that may be. In this case, we're talking about mental health clearly. So people who work in the sector who do have lived experience. I think often it's easier to talk to someone when you can see that they've been through not the same necessarily, but a similar situation to what you're finding yourself in. And there's just that higher level of understanding with a peer support worker.
Was that the kind of practical support that your team members offered as they went door to door?
In terms of practical support, what my team did, was a lot of linking with services. Peer support services are available. They are still being developed within the sector to have a high percentage of peer workforce, and obviously this survey has shown the value of that. But yeah, my team were able to, for example, they helped a few different people to join up to the NDIS. So people with, severe and persistent mental health issues who would be eligible for NDIS but didn't know where to go for access, didn't know how to do that. The team were able to support them to link in with the NDIS to then go on and get NDIS plans, which is fabulous. We did a lot of networking, obviously, around the region. So other services that are available within Ipswich.
Do you think the survey numbers in Ipswich would be reflected across wider Ipswich and the other areas you've surveyed?
I think that they would be quite similar, yes.
It's interesting that this part of the survey was in more traditional Ipswich, like Ipswich Central, West Ipswich. Where I was leading to with that is I was wondering if it would be the same sort of result in the newer suburbs.
That's a hard one for me to answer because obviously that wasn't one of the regions that we surveyed. But having run this project personally across a few different sites now, very similar results are coming through for all regions. You know, essentially, we don't have enough services. Even if services are available, there's not enough, information out there for people to know how and who to access. There's still a lot of stigma around discussions about mental health, and we know that. So it's services. We're lacking services and we're lacking resources to connect people with services.
Did you keep any data on how long, on average, did your team members spend with each resident?
Variable, but people that engaged in the survey, an hour or more.
Right.
So the people that were really interested in, in what we had to offer, in our resources, in actually just having a conversation with the people connectors, that would be half an hour, 45 minutes, sometimes longer. And then if they completed the survey as well, up to an hour or more.
From where I sit, the help that you offered and the survey data you collected, it doesn't seem to be coming from any other organisation in the sector. Would that be correct?
That is correct. This is, Community Mental Health Australia were really incredible in securing the funding for this project. As we'd said in our previous interview, it's Australia-wide and it will wrap up at the end of this year, and then all of those survey results will be released for every region that we've worked across.
Tristan Brownson, it sounds to me as though this could be or should be an ongoing survey of areas of Australia.
Alan, I 100% agree with you. And I'm more than happy to bang the drum in saying that this has been so valuable. And like I said, I've done this across a few different regions now, and it's the same. People want outreach. People want to know that services are there that they can access. And the best way to do that is to go and knock on people's doors and say, hey, here we are. What do you need?
Well, thanks so much for sharing that critical data, and more specifically, it's Ipswich data, and it's very current, as you said, just before the floods. And I hope things progress and we hear about more support for residents who actually need it. Tristan Brownson, thank you again for talking with Ipswich today.
Thanks so much, Alan. It's been a pleasure.
You'll find handy links in the show notes to the full Ipswich Community Report and to the ACDC project. Ipswich Today is supported by Kinetics, people-powered web hosting trusted by Australian businesses since 1999. This podcast is also listener-supported. Please make a once-only gift or regular donation to help keep it online. Just go to ipswichtoday.com.au and click the donate button on the homepage to make a payment through PayPal. Follow and stream this podcast from your favourite app, including iHeartRadio and Amazon Music Podcasts, or play Ipswich Today from smart speakers. Music is supplied by Purple Planet Music. This is Alan Roebuck. Thank you for listening.